Hi, I'm Ken Johnson, CEO of Hutchinson Regional Healthcare System, and I appreciate the opportunity today to visit with you for a little bit and pass on a few items of information that I would like for you to be aware of. First of all, I would just like to thank everyone for the amazing job that you're doing in caring for our community. I know this is stressful times, and we are faced with a health crisis that we're not used to being accustomed to. And everyone is doing an amazing job in taking care of our patients, our staff, our providers, and working together. And I do want to offer that, our community and those that we serve and those that we work with are looking for us to be leaders and be the calm in this storm. And so I would ask you to do everything you can to provide that 5-star customer service, be the person that our community and our patients and our families need us to be, and that is also remembering to be very attentive in serving others and serving those that we come in contact with, and demonstrating our ICARE values. And I'm hearing great stories of these kinds of things happening, and I commend everyone as part of our team for living our values and demonstrating those values every day, and I appreciate that very much. So there's a couple of things that I would like to ask for everyone's help with. The first thing is the fact that we are reducing access to many of our facilities. And as you know and are probably aware, with the hospital, we have reduced access to 2 entry points, and those are set up with screeners. We've also asked physicians and our staff to enter in certain areas. And I would like to ask you as staff to please honor the request and the entry points that you've been asked to utilize. At Hospice and Home Care, at Hospice House, that is a restricted entry point, and also at Horizons. And so I know it is disruptive. I know it puts us out of our normal routine, but as staff and employees of Hutchinson Regional Healthcare System, as you know, we're putting these things in place for a reason, and I would ask that everyone that makes up our team that you honor those requests for where to enter the particular facilities that you're entering. I said something the other day at a panel at our chamber, and I was asking our community for patience and grace. And I think we can all extend that to each other, especially to those folks that are sitting at the screening stations and asking you questions and trying to make sure that folks that are entering our facilities are there for a reason and that is adhering to guidance that we've provided. The second thing that I would like your help with is travel. So travel involves business travel and it involves personal travel. First of all, I would like to ask you to help us and adhere to a restriction against all business travel. When we take the guidelines from KDHE and our own analysis in addressing this situation with our COVID-19 health crisis, we think it's in everyone's best interest to not travel for business-related functions. I know we're joining many, if not all, organizations in that same request, but I wanted you to be aware of that request. And the second aspect of this is that as we try to quarantine and quell the spread of this disease, that's one way we can help. Another way is with the restriction of personal travel. So we're asking everyone and we're discouraging everyone from traveling outside of our immediate area. We understand there's reasons that you may want to and need to, but we're asking you to sincerely consider not traveling outside of our area. There are lots of hot spots in our, around us and other states in our nation, and we would ask you to stay close to home. The other aspect of that is we don't know when we might have a surge of patients that are going to need our care, and we're going to need you to help us provide that care that's needed in our community. Our community is depending on us to be available and to be here, and if we're quarantined or if we're not able to provide that care, then we're not able to serve our community. So thank you with that. You know, one thing I want you to know sincerely from me is I'm very proud of everyone that makes up our healthcare system. We have a great group of people that are employed and served through our healthcare system, and I have every confidence that we're going to be able to work together to get through this healthcare crisis. But I also would like to commend our other healthcare partners within our community. I have been involved, and many of our executive team members, and probably many of you, have been involved in meetings and discussions in planning and preparing for what our response is to our COVID-19 crisis. And I can tell you that we have a great group of people and providers and healthcare partners within our community that we've been able to work with to help address some of these concerns. And I just, I'm sure I'll miss someone, but or some organization, but you can imagine that there are any number of people within our medical staff, from Hutchinson Clinic, from Prairie Star, Summit Pinnacle, leaders at the city, state, local government, health department has been very much on the front lines, and we're in lockstep with a lot of the recommendations and guidelines that are being offered through our local health officer, Nick Baldetti, and KDHE. And I just want you to know that I'm very pleased to say that we have a very collaborative group effort in addressing this. Certainly, as the largest employer of our community, Hutchinson Regional Healthcare System has many other partners that provides healthcare services, and we depend on those partners. We have a great medical staff, broad scope of services that are offered, and so we're being able to leverage those relationships and the experience and expertise of many other providers in addressing this issue. I know that we will get through this crisis, and I believe that when we do, we will find that we have a stronger community, that we have been able to exercise a disaster plan and a plan that has addressed this crisis and actually been able to enhance those plans. And I also believe that we will see a renewed sense of community because we've all been able to collaborate and work together to address this. I think it's a great example of how we're stronger together, and quite frankly, how we can, in working together as a community healthcare leadership team, be the hub for healthcare for Reno County and for our citizens in Hutchinson. I sincerely do appreciate all the efforts and all the service that has been provided by many of our healthcare partners in our community. And I do want to remind everybody the two words, again, that I mentioned earlier, patience and grace. Let's extend patience and let's extend grace to everyone we come in contact with, to each other, to certainly to our patients and our families that are very concerned about the crisis that we're going through. One of the things that I like to do, and as many of you know, is provide a quote. And there is a quote that I like from Booker T. Washington that says, "If you want to lift yourself up, lift up someone else." So please know that everything you do every day is appreciated, and you are making a tremendous difference in the lives of our community. And I want you to know how much I appreciate that, and I know others do as well. So thank you very much.